The broadcast is now starting. All attendees are in listen-only mode.
Well, good afternoon, everybody, and thanks for joining us. And happy belated Father's Day and Juneteenth. It is Monday, June 20th, 2022. It's 2 o'clock in the afternoon. And you've joined us for the Los Angeles County Emergency Preparedness Updates. And generally, as a bit of a background, what we like to do on these webinars is provide, we attend the DRC meetings at the hospitals throughout Los Angeles County. And while we actively encourage everybody to participate in their local DRC, we know with folks, time commitments, sometimes it's difficult to attend the DRC meetings when they happen. So we try to collect as much relevant information regarding skilled nursing facilities and intermediate care facilities, and then relate those to you on a quarterly webinar. And so we're having our webinar today. We did not have one earlier this year, and that's because we had our coalition meeting at the Really Ready conference. So we will have another one in September, and then again in September, October, beginning of December. So mark your calendars. I believe if you go to GoToWebinar, you can sign up for all three of them, this one and the other two later this year. All right, that being said, let's go on to the next slide here. If I can get my stuff to move. Yep, there we go. All right, so speakers today, because this is actually, I believe Los Angeles County has officially recognized this as a holiday, even though it's not a state holiday. So Jennifer Calderon from Los Angeles County EMS Agency will not be with us today, but she's normally our program officer for LA County EMS and all disaster planning related stuff. My name's Jason Belden. I'm the Director of Emergency Preparedness at CAF, and with me today is Mary Story. Mary Story is our program coordinator for our disaster preparedness program. Do you want to say hi, Mary?
Good afternoon. This is Dr. Mary Story helping out with Jason.
All right, thanks, Mary. Appreciate it. All right, and so those are the players for today. And hopefully what we'd like to do is discuss those DRC updates, any CMS and state updates as well. There was a CMS directive the other day, and I before folks ask questions, I'll just let you know, I heard CMS was dropping their requirement for staff to be, their surveyors to be vaccinated. I don't know that that applies to the California surveyors or if that's a state-by-state judgment, but I know that came out, and I had a couple of people reach out and say, well, gosh, does this now apply to our state surveyors? Will they drop their mandate? And if they do, can they drop our mandate? And so I don't know the answers to those questions. So if you've heard that and you have questions about it, our hope is we'll put CDPH's feet to the fire on tomorrow's all provider call in the morning. As well as we'll discuss the state updates. There was an update to a pretty important AFL. We'll just mention that, even though I know in our county right now, in Los Angeles, and the other two public health departments, Pasadena and Long Beach, are both have much more strict requirements right now during the current surge. And I'll discuss all that in a second. We'll talk about upcomings and trainings and webinars. We've got a bunch of stuff planned. Some of it is free and some of it has a cost associated to it, but we'll cover both of those, as well as recent guidance from LA County Department of Public Health. We want to talk about like vaccination and treatment options. I've had the folks at the ACDC unit reach out to us and really kind of encourage us to embrace all these different treatment options and continue with our vaccination progress as our residents get closer to the 4 to 6 month mark after their last booster shot. I think it's likely that we're going to see another recommendation to continue to boost, especially our residents. I don't know that that's going to apply to staff. Maybe they will in the coming months, similar to the current CDC recommendation for anybody over 50 to get the booster shot, the second booster shot anyways. So I think those are likely a recurring kind of thing for our residents, and it's probably appropriate to plan for that now. Start looking at when's the last time they got their most recent booster shot, excuse me, and talk to your medical director about is continued vaccination appropriate for this person, and then possibly talk about Evusheld as a prophylactic treatment if they're severely immunocompromised. I'll talk about where you can locate those medications, because the DPH wanted to reach out and just really highlight they have lots of stuff available to folks. Things like Paxlovid you could order through your long-term care pharmacies. But if you're having difficulty obtaining those treatments, please reach out to us as soon as you possibly can to let us know, so we can pair you up with the folks at DPH to identify where you can get those medications. All right. As a reminder, we throw out a lot of acronyms on these webinars. These are just some of them. I keep this as a standing kind of item. I've already said DRC, and maybe this is the first time you've been on our webinar and you don't even know what a DRC is. And I'll explain that in a second. But we mention constantly DPH or LAC DPH, or the Medical Alert Center. All these things are acronyms we mention quite frequently, just for your edification anyways. All right, so here's a picture of us in Los Angeles County, and you can see we're pretty spread out all across the county. Now, in Los Angeles County, they do healthcare coalition meetings, just a teeny bit different, or quite a bit different than every other county in the state. And so generally, rather than having one coalition meeting, the county has divided up into 13 what they call disaster resource centers. And so you saw a map of where these skilled nursing facilities are. You're going to want to find your closest disaster resource center, and I'm going to give you the contact information for each one of these folks in the slides to follow. But essentially what you're going to do, if you've never been to one, I highly encourage you to attend one, even virtually. Virtually makes it a lot easier now. You don't have to drive and find parking and all that good stuff. But it's good networking to get in with the folks that are going to be in the response side of things if we're in a natural disaster. And so generally they hold these at the hospitals, and the hospitals are responsible for pulling together an agenda, bi-monthly, to talk about, disaster planning, training, exercises, classes, tools, templates, all those kind of things they discuss at those meetings. And now, because I attend them all, I hear a real common complaint that there's very little or sometimes no information that's applicable to skilled nursing facilities. And sometimes that's true, sometimes it's not true. Unfortunately, I can't guarantee you what the agenda is going to be every week, but I will say that if you're looking to prioritize the meetings that you should attend for the DRCs, whether it be virtual or in person, is the two meetings that will help you meet the regulatory requirements. So the disaster resource centers are responsible for doing your hazard vulnerability assessment from a community standpoint. So there's a CMS requirement that you have both your own individual hazard vulnerability assessment and a community hazard vulnerability assessment. So both need to be included in your plans annually. And so that's an annual process you need to do. One time a year, each one of the DRCs has an HVA meeting where they go over the risks from all the different healthcare providers, and they use that to build that kind of coalition or community-based HVA. They will then email that out to everybody that participated in the building of the HVA. So that's a really important one, because I'm not sure, you may be able to coax them into sending you the HVA if you don't attend the meeting, but I don't know that they're going to be real pleased to do that. In any case, it's something you're going to need, and surveyors will ask for that at time of survey. The second meeting that you really want to prioritize is they're going to do, generally they're going to do a tabletop exercise at least once a year. And that tabletop exercise is normally a kind of a pre-event for the full-scale or community-based exercise that follows it. And so even though the DRC, you wouldn't go to the DRC for the full-scale exercise, you may go to the DRC for the tabletop exercise, or they may have a tabletop exercise at a central location where a bunch of providers can go there. But those are the two meetings you really want to participate in because it helps you meet those regulatory requirements. Now, does it mean you have to go to the tabletop exercise meeting? No, but it's just going to give you one of those two exercises that you're required to do every year. So if you choose to do your own tabletop exercise, or you go to one done by somebody else, or put one on by yourself, that all those are fine. But if you don't want to go through the trouble of doing that, or you have not identified anywhere else to do it, then that's a great location to get your tabletop exercise out of the way. So besides the networking and besides the education, the free education that comes through every meeting, I think there's two really important meetings that you guys got to put in your timing. Now, the HVA meetings from usually are at the beginning of the year. So if you've not had a chance to do that, I would reach out to one of these DRC folks and see if you can get a copy of the HVA for 2022. All right, I mentioned the contact list. I believe this is all still current. So if you're close to Region 1 or Kaiser Los Angeles, Adam Richards would be your best contact. These slides are included in the handout, so you have all the links and stuff like that to them. But I would say, look at the map, find which one seems to be closest to you, and then email them and find out when the next dates are, and ask to be put on their listserv, so at least you get notification of when the meetings are. And I'll go through these. So there's Cedars at UCLA, there's Harbor, UCLA, South Bay, Henry Mayo, Newhall is the DRC, LAC, USC is the DRC, Long Beach Memorial is a DRC, PIH, Pomona Valley, Providence, and Providence St. Joseph's are the main DRCs. Now they do have some DRC specific to pediatrics, and but I didn't put those up. But if you're a pediatric subacute on this call, I think that there's only two of you guys, and you're both go to the meeting, so I don't think I have to connect the two of you guys. But if you're a pediatric subacute and you don't know who your DRC is, just reach out to me, and I'll get you the information. All right. So we had the ECDC unit posted public updated guidance based on the Los Angeles County Health Officer order. And I know you guys have been living this for the last couple of weeks, but I just want to reiterate, kind of what they're saying. As to when this will change back, it's all going to be tied into, that community transmission. And right now, Los Angeles County, as well as most of the state of California, is in high or substantial transmission, and high is the highest category, and that's what Los Angeles is in. And I think most of you have probably experienced that. You're probably seeing ongoing transmission within your facilities and things like that. It's making it very, very difficult. I've talked to a number of providers that are struggling just as much now as they have at any point during the pandemic with staffing and things of that nature, being closed for new admissions for long periods of time. It's a struggle, no doubt about it. But our hope is that once this surge abates, we'll go back to the normal requirements that is being dictated by CDPH, rather than these more stringent requirements dictated by the public health officer order. So they just wanted some clarification. These two came out. Antigen testing is acceptable to fulfill new screening requirements for both staff and residents. So they wanted to clarify that in their update. They clarified it that response testing can be done once weekly for all staff and residents being tested, regardless of the routine screening testing schedule, unless specified by the outbreak investigation to be more frequent. So, and I've heard in those cases, sometimes they are coming out and asking for more frequent testing than that. This is a big one. N95 respirators are required for use by all staff that work in resident care areas and areas accessed by residents for any reason at all times when working in these areas. So that's a pretty broad scope of who should be wearing N95s, and it is as source control. I imagine if there were some unique circumstances where you had a staff member that had a medical exemption from wearing a respirator. And in those instances, as terrible as it sounds, I think the actual workaround would be to provide them elastomeric respirator or half-face elastomeric respirators or a PAPR, or one of those two things, so that they maintain that respiratory protection at all times, but they're not restricted by the N95, because N95s can be fairly restrictive in terms of breathing. So if you had somebody with some breathing issues that could not be fit tested because of it, then you would have to offer them one of those two things, or some kinds of alternate work schedule that kept them out of those areas. Anyways, twice weekly screening testing for staff members and weekly screening until further notice. So that obviously got changed just slightly. I'm sorry. I apologize. This is the screening testing is twice weekly, but once you're in response testing, it's once weekly after that. All right. Let's hop to the next. And a big one, pause on communal dining and group activities until further notice. Notice that didn't say anything about visitation, so there's still we still want folks to do visitation. Okay, there we go. Sorry, I thought I moved too fast. All right, so upcoming trainings. If you're not on ReadyNet, or if you just want a refresher on how to use ReadyNet, there's a ReadyNet training webinar June 29th at 2:30 to 3:30. That second link is the link to register to the training. But on ReadyNet's websites, they have training videos and a user guide already. And things like if you can't remember what your login is, you guys have a ReadyNet account. I think most of the facilities in the county have a ReadyNet account. Over 300 of you guys do. And so if you just can't remember how to access the account, you can email support at ReadyNet. They'll send you your login, password, all that good stuff. And they'll even go as far as setting up custom training for you and your staff. If you give them enough time, they'll be happy to schedule it for just your company. Los Angeles County DPH is asking that if your facility is not receiving the contacts from any of these things when they come out with the updates, whether it be an update on like the testing requirements or screening requirements or the PPE requirements, if you're not getting any of those contacts, or maybe they're only going to one person at your facility, and sometimes there's something gets lost in the shuffle and you feel like you're taken by surprise. I don't know that there's any reason everybody couldn't be on the same listserv. So if you want to set up more people than just your infection preventionist or your DON, I think that's more than appropriate to have multiple people gaining the information at the same time. And then if you go to the ACDC page where I had linked on the previous thing, it records recordings from their previous webinars as well as a slide deck and things like that. So if you go to that SNF page, I think it's, that link up at the top here, if you go to this link up at the top here, and you scroll all the way to the bottom, it's a big long page, but if you scroll all the way to the bottom, it's got a link for their recordings and things like that, as well as a link to the CDPH Wednesday webinars and where you can get registered for those. All right, so I talked about, the ReadyNet training. That's a free training. I will mention this, that we are going to start doing what they call service polls with ReadyNet. So in the next couple months, and this is a part of the CMS requirements, is for us to be able to, multiple things, communicate back and forth, with our response agency, but also we have to demonstrate the ability to share bed polling information during a surge. So that's what ReadyNet is. It's a way to identify surge locations in the event of a natural disaster. And so what will happen is you'll get us this thing called service poll. It'll come out and it'll just ask you some, simple questions like, are you okay? check mark the green box if you're doing just fine. Check mark the yellow box if you're doing okay, but you have some services impacted. Check the red box if you are not doing okay and you have multiple services impacted. Check the black box, and that means you're evacuating. Things like that. It's really simple, like, how am I doing? That's one set of questions. And then the next set of questions were, how many open beds do I have by male and female? And do I have any subacute folks in there? Things like that. Those will be the, and we're talking about bed openings, not, total number of people in those beds. But so those are the things that come. It takes, really 2 or 3 minutes to input the information, and you go on about the rest of your day. In previous efforts to try to get folks to utilize this system and support it more readily, that was a bad choice of words, but in order to support this, we've got to do better at responding to these service polls. So my ask is to you guys, everybody on this webinar, and those that listen to it in the recorded version, please don't hesitate to, coach one person or 2 people on how to input this information. And then on the day of the service poll, we'll try to send out a reminder, a week or so before, so that you can get your folks prepped. But I would love for us to have a really good showing the next time. Part of this information that after we go through these bed polls, I'll give you an example. The last time we did it, there were 273 facilities that received the service level poll, and only 2 facilities responded to the poll. And so now we've gotten better, but that kind of information has made itself into like an OIG report that that the Inspector General is looking at as a way to kind of poke a finger at us for not doing all we can during to prepare for disasters. And that's not the message I want to give to these folks. I want them to know that we are plugged in, because I know we are, because we're doing emergency response each and every day for the last 2.5 years. It seems like. So I know you guys could do it. It's not a matter of that. It's a matter of us just connecting the dots so that they can see we know what we're doing. All right, that's my soapbox for ReadyNet, but hopefully we get everybody to participate. In terms of the Caf Summer Conference, it's coming up shortly, and this one's a bit farther away, so I realize not everybody will have an opportunity to join us at the Caf Summer Conference. Generally, the Summer Conference is our educational conference, so we have a broad array of things from disaster preparedness and infection prevention and things of that nature, fire and life safety, clinical programs, reimbursement, all that good stuff. Those of you that have gone to these before, they're wonderful conferences. I get it. Monterey's kind of a difficult spot to get to, but I just wanted to let you know that we will be meeting in person July 10th in Monterey. And CAF is having an infection prevention in-person conference. This one's going to be much closer to you guys. And while this is it's going to be geared exclusively toward infection preventionists, we will have some really great classes on and presentations on how do we see this thing end, and what are the things, how do we see COVID ending? Maybe it's not going to go away, but maybe there's an end to our public health emergency. And when it is, what are those infection prevention and infection control requirements that are going to stay static for the foreseeable future? So we'll discuss all of those things. We'll have a number of great speakers. Dr. Aaron Epson from CDPH will be there, Dr. Namali Stone, and I from the CDC. So the 3 of us will finish up the conference, and we'll talk about those specific things about where we see things going for in the future. And I know there's a ton, just a palpable sense of fatigue with this. And maybe by just saying, look, these are going to be permanent changes, let's move on and let's try to fund these permanent changes. I think that's likely going to be the outcome. And I encourage you to have your infection preventionists come with data, come with information about outbreaks and what you saw, and so that you can give feedback to the people most involved in making the decisions at a national level or a state level on how we wrap a bow in COVID and move on with the rest of our lives. And so this could be a really powerful and impactful session. So hopefully you can convince your infection preventionists to get out of the building for a couple of days. Newport Beach is not that far away, so it's a pretty close drive. And then on September 14th, we're going to resume our Los Angeles wrap sessions, and those are generally where we have the folks from HFID and ACDC and come out and DPH and talk to us and give us a presentation. Now they will respond to questions, but those questions have to be submitted beforehand. So if you have questions beforehand for HFID or DPH, things of a big nature that you want us to have them answer, if you know Joe Diaz, you can reach out to Joe Diaz, jdiaz@caf.org, and you can send him some questions to forward on to them. Or if you want, you can forward them to me, and I will make sure Joe gets them to get included. And while I didn't put this on here, two trainings just coming up after that will be in response to the events from Uvalde and Buffalo. We've had a number of work group meetings with providers who have signaled a desire to have some armed intruder and active shooter training. And so we have a couple of consultants as well as myself who have done presentations on active shooter and armed intruder. And so to that end, we're going to offer a one-day standalone class. If you're going to the annual conference in Palm Springs in November, it will be on the Sunday preceding the conference, and it'll be a full-day class. There will be a charge for the class, but you can attend it and not attend the conference. If you're going to the conference, then the class itself is less expensive. If you're one of those folks that you just can't get out of your building to go to the CAF annual conference, or your ownership doesn't send folks to the conference, we're going to try to do an in-person session of the same class in December. I've got to find a location for it. I haven't talked to Ararat, but Ararat has a great, really large ballroom, and I know there's other providers out there that have really large spaces. If you're one of those facilities and you would like to host us, and you have a large meeting space that could accommodate 100 to 150 attendees, please reach out to me, and maybe we can arrange to do it at your facility. The hope is that if we have some grant funds from LA County, we're going to offer this at no cost. I don't know that I'll have the ability to record it and make it into like a virtual session. It's generally like a 6-hour class, 5 to 6 hour class with a lunch in between. And in order to record that much video and hire staff to record all these sessions, I don't know that I'd have enough, be able to afford to do that and still offer it for free. So I think that the plan is to do it in person if we can, and then if we had to, we could offer it virtually. But I'd love to hear if you got a big ballroom and you'd love to host us, especially if you've never had a CAF training come out. I think it would do wonders, and you get a bunch of your staff that could attend that wouldn't necessarily be able to go out to another training. So, all right, now I wanted to switch gears and talk about an opportunity for those of you that are in the Los Angeles County Department of Public Health jurisdiction. For those of you that are in Long Beach or Pasadena, I apologize, this does not apply to you. And I realize this is a Los Angeles County webinar, but Los Angeles County actually has 3 public health departments within it. That's Pasadena, Long Beach, and LA. And so when we're talking about public health things, sometimes LA public health gets funding that the other 2 public health agencies don't get. And that is true in this case. So the Los Angeles County DPH received a grant from the CDC to create this TNT program. And it's an all-inclusive, financially supported collaboration between LA County DPH and LA County skilled nursing facilities with the overall goal of improving safety and care for residents, staff, and visitors. So that's the goal, the kind of overarching statement. here are the kind of things that they plan on, hopefully achieving during this is improving the knowledge base and impact of SNF infection preventionists, standardizing infection control practices. So I think their goal is to come out with a comprehensive scope of work that will effectively help IPs utilize their time. I know, especially in smaller facilities, they go, oh, hey, what am I supposed to do with the rest of my day? So the goal is to create something that's going to standardize those practices and give folks a roadmap for success. Provide standard quality improvement structure and framework, foster a culture of safety and accountability within the SNFs, and then to talk about reporting using the NHSN network. And that is, that's one of those overly complex things, but, using data in disasters, especially pandemics, can be instrumental in helping us, pick the next course of action. Now, you may have some comments about whether we're using the data correctly. That is up for debate for sure. But I think as we plan to go forward, we've never been a part of the public reporting for NHSN, prior to the pandemic. But that's one of those things I don't think is going to go away. That's probably it'll change somewhat from a daily report to something less frequently. But I do think NHSN reporting is going to be a part of our life for forever now. All right. So what are the benefits of participation from everybody's perspective? So the hope is to improve and expand your rural resident culture of safety. Hand hygiene adherence rates hopefully would be improved. Improve EVS adherence rates and decrease HAIs. That's a really important one. And it's not just for COVID. I mean, COVID's, all consuming now, but we've got plenty of MDROs that are impacting facilities within the county now, CRS and crab and some other nasty bugs. We definitely have opportunities for improvements, even when it comes to flu and things like that. Financial awards to facilities upon completion of the program, and that's your buy-in. That's where you guys are going to get excited. You'll get a fluorescent marker kit, continuing education units, so CEUs for all licensed participants, regardless of their licensure category. They're going to have CEs for that. Certificates of completion for both licensed and non-licensed participants, and certificates of participation for all facilities. So this will be something you'll be able to post publicly so that will indicate your completion in the program. And so I think it's a fantastic opportunity. CAF, a number of chief medical officers from skilled nursing facilities sat together to kind of come up with the formation of this project. And the good news is LA County is committed to giving each facility $16,000 upon completion of the TNT project. So in order to complete the program successfully, you got to sign a facility commitment form that's linked in that top link. You're going to designate up to 3 staff members. One of them has to be your IP to attend the training sessions. Designated participants to attend 80% of all live didactic sessions held virtually. Proof of final project completion. Active participation and engagement of the participant during those sessions and small group discussions, and a recommended attendance of office hours by any of the designated participants. So there is a time commitment for sure. Hopefully that financial support will more than offset the cost to implementing the program. And the benefit is you're going to have better trained staff, and your residents are going to be less likely to be impacted by things like HAI. So I think it's a good program. If you have next steps, this was originally supposed to end on June 14th, but they still feel like they have enough room for facilities that haven't signed up. So if you're among one of those facilities that's not signed up, you can do it between now and June 28th, but you have to get that the information in. And there's a website that that's a different website. So, but in any case, Oh, no, that is the correct website. So the TNT program website lists out all of those things that I've just kind of covered and everything like that. And there's a question box or an email question box that you can send questions to if you're having issues submitting any of the forms or anything like that. So hopefully that that gets you guys some good training and some good money. And at the same time, I was having those conversations with the ACDC unit. They wanted to really encourage folks to not just incorporate testing or incorporate treatment options for your residents, and that's important to contract with your local pharmacy and talk to them about receiving Paxlovid or Molnupiravir for folks that can't do Paxlovid. Um, and also reaching out if you have immunocompromised folks that you would like to get Evusheld. Now, generally they're restricted to the hospitals, but I believe in instances where you can show there's a clinical need, they can get you the medications. In terms of the test to treat program that you've heard the federal government talk about, there are literally hundreds of locations throughout the county for your staff that test positive. And so if you have staff members that would benefit from the treatment options, especially older staff members or those with, compromised health conditions, I would encourage them to at least contact their personal physician and look at test to treat options. There are a bunch in the county. There's even on the test to treat website, there's ability to get the stuff delivered to you. So you wouldn't even have to go in if you had a positive test. You could call in and get an e-prescription, and it could be FedEx to you the next day, or you could have somebody go pick it up for you. Anyways, there's really ample supply of these antivirals, so we don't want to hesitate to use those, especially in the case of our residents who has been shown to have a good benefit for. So, but I wanted to let you know that you can offer this, or at least make your staff members aware of the test to treat options for them if they want, or for their family members to that, for that matter. All right, so I talked about CEPH released an update to, it was actually AFL 2053.6, which was for, May of 2020 is when that came out. Well, this is the update to that AFL, and then you've renamed it AFL 2213. I'm not going to go over these changes because they are they're really different than the Los Angeles County order. So I don't want to confuse folks and say the state can do this and you can do that. I think we've gone over what all of the more restrictive stuff. I think we'll continue with that until further notice. And I'm sure Dr. Rubin and will send out an update, or the ACDC unit will send out an update once the surge is abated. The problem is, I think we have to go back from high, back through substantial down to moderate before they will change some of these more restrictive orders. So I have not confirmed that with Dr. Rubin, but based on their previous actions, I would say that's likely. All right. I don't know why this is on there. I thought I deleted that slide. All right. All right, so in terms of exercises that are coming up, the DRCs, we talk about them having the tabletop exercise, but this year, I'm not sure they're going to do a tabletop exercise. They may, I just don't know yet. I got word last week that Los Angeles will be doing a full-scale / functional exercise called a MERCY exercise. It's a medical response and surge exercise in November. I have reached out to the exercise director for Los Angeles County and asked them if I could write in some objectives based on the scenario that they've got to have us be able to have an opportunity to participate. I think that's going to be likely. So we'll get that. Once we develop the work and we get a date for when those things will happen, we'll obviously communicate that out and probably talk about it on the next webinar that we have in September. But generally, you've got to do one full-scale exercise and one tabletop exercise every year. That's a requirement from CMS. Now, this particular year, especially if you've had an outbreak of COVID in your facility, chances are you have activated your emergency operations plan. And by regulation, that activation of your emergency operation plan can be used to as one of your full-scale exercises, or in lieu of a full-scale exercise. And we've talked about this before, but I think, if you keep having to activate your emergency operations plan, and you're doing an AAR or an after-action report and an improvement plan after each activation, I don't think from a regulatory perspective you would have to do the full scale. Does that mean you shouldn't do the full scale if given the opportunity? No, I think practice makes perfect, especially if it's something that's non-pandemic related that'll make us change our brains into thinking how we would respond to it. I think I would highly encourage you to still participate, although I think maybe we might get a break on the regulatory requirement this year. The statewide medical health exercise that used to happen every November is going to be changed. The dates are going to be changed to April, and the statewide medical health exercise, or the state full-scale exercise, will not happen again officially until 2024. Now, the state exercise work group, I sit on that work group. We will develop exercise materials that you will be able to use in 2023, but it will be up to the individual counties to see if they're going to participate. We don't know that yet, but we will create the materials just in case. So in the handouts today, I included an updated contact list courtesy of one of the DRC coordinators, an operational continuity cybersecurity incident or cyber incident checklist. And this is, if you're used to talking about incident response guides for NICS, this is a similar style checklist that walks you through a response guide for what to do in a cyber incident. Now, this is obviously written with the kind of a hospital perspective, but there are a lot of lessons learned and a lot of things here that we could derive from that. And so I wanted to get that out to folks that didn't attend that DRC meeting. I also included the ACDC highlights, although they're a little dated, but that was from the last DRC meeting that handed them out. And as a reminder, we have video archives of these webinars, and that's the playlist down below. It should take you to the Los Angeles County webinars that we've done throughout the years. And I think at some point I'll probably purge them because this information becomes dated very, very, very quickly. So, but in any case, if you didn't catch all of the information, you want to go back to the beginning, you can. I'll hopefully have it posted here this afternoon, so it should be up for you can watch tomorrow if you need to rewatch any portion. All right, let's see. All right, there we go. There's my contact information and my phone number. As always, cafdisasterprep.com has tons of resources, tools, templates, links to videos, trainings, gosh, you name it. In terms of Los Angeles County specific stuff like the map for the DRCs and things like that, they can be found on our page for LA County. All right, so I see we got some questions in the question box, so I want to get to those. Let's see here. All right, this ACDC updated includes ICF DD facilities. No, Grace. Thank goodness, no. You guys don't have to do the same stuff that SNFs do. They may have some other requirements that are different than the states right now. I'd have to go back and look, Grace, but I don't think so. But they keep that information in a different page on their website. But no, the ICFs should not have to fall into that. So. All right. Well, if we have no other questions, I think I can probably let everybody get out of here. We're at 2:45 now. So, all right. Yes, yay. Exactly, yay. All right. Well, everybody, I'm giving 15 minutes of time back to your day. I really appreciate you guys joining us on a quasi holiday. Hopefully it'll be a state holiday next year. But in any case, if you're a father, and I miss wishing you happy Father's Day, happy belated Father's Day. You guys take care, and we'll talk to you soon. Thanks. Bye-bye.